Good morning, everyone. Thanks for joining me here today. Today we're going to talk about caring for vulnerable populations in a time of crisis, focusing mostly on personal protective equipment, or what we call PPE. So my name is Haley Moore. I'm a registered nurse here in Calgary, and I'm the co-founder of Westside Harm Reduction. So I've about 10 years experience working within harm reduction within that vulnerable sector, mostly with individuals who use substances and also within sexual health. So we'll get started here with this presentation. It'll be about a 30-minute long presentation with an opportunity for questions after. There's just a few things I like to touch on before I actually start presenting. And one of them is which Westside Harm Reduction has collaborated with Street Cred and the Calgary Foundation. So we would like to thank both organizations for funding this initiative through the Boys and Girls Clubs of Calgary. Without this initiative, these webinars and this platform wouldn't be able to take place. So we are very thankful for that. However, all presentation and promotional materials are created and presented by Westside Harm Reduction. The second thing that I'd like to acknowledge is acknowledging our First Nations. So we would like to begin by acknowledging that the land upon which we gather today is Indigenous land. We also recognize that the traditional Blackfoot name of this place, where the Bow River meets the Elbow River, is Mokinstis, sorry, I always pronounce that wrong, which now we call the city of Calgary. We would like to acknowledge that we are on the traditional land of the Blackfoot Confederacy, Siksika, Kainai, and Piikani, as well as the Treaty 7 territory, which includes Tsuut'ina and Stoney Nakoda, which is comprised of the three bands of Chiniki, Bearspaw, and Wesley. Calgary is also home to the Métis people of Region 3. And then the last thing that I like to acknowledge is that while we're going through this webinar, yes, it is a different platform than we're used to. I, for one, am not used to presenting online with Zoom, but this is still a safe place. So we're gonna respect that everybody has some fears right now and respect that any question is okay. So because we will be having a question answer segment after this, feel free. This is a safe place to ask those questions. Also that the effort to address COVID-19 is both extremely important for us all and poses a range of challenges on individuals and families as they respond to the demands of this situation. This situation is stressful for everyone, and it's normal to be anxious and worried. This webinar is designed to answer questions, offer suggestions, brainstorm, be a collaborative approach to this infection that we're discovering in real time. So a lot of this information is constantly changing, and that can cause a lot of anxiety for people because policies are adapting, procedures are constantly changing. And this is just a place where we can help cope with this developing situation and provide the most up-to-date and best practice that we are finding, and to hopefully disseminate some information that just to everyone, because there's so much information out there, and sometimes it can be difficult to understand what information is factual and what is potentially not. So that is the purpose of these webinars. So any question is okay. Everyone has some fears right now, and that's okay. We're all in this together, and we're gonna work through it together. So what we're gonna be covering today is we're gonna talk a little bit about some updates with COVID-19. So some things have changed since the webinar on Friday and on Wednesday, and I just want to stay up to date as possible. So I will, we'll talk a bit about that. Then we're going to talk about personal protective equipment mostly for staff. And then we're going to talk a little bit about personal protective equipment with clients. And then we'll get into questions. So those are our goals for today. I will try to be as least boring as I can, even though this is such an interesting dynamic for presenting. So bear with me here. So COVID 101, so what this infection is, it hasn't changed. It's still a large family of viruses found mostly in animals. In humans, they can cause diseases ranging from the most common cold to more severe diseases such as severe acute respiratory syndrome, or SARS, and the Middle East respiratory syndrome. So that hasn't changed. What has changed is the amount of cases that we're seeing here in Alberta, and the distribution of those cases within Alberta. So up till yesterday at 2 p.m., we've had 2,908 cases in Alberta. 71% of those have been in the Calgary zone. 149 have been hospitalized, 40 have been in the ICU, and unfortunately we have had 50 deaths within Alberta. I just do want to touch a little bit on the Calgary zone and within Alberta here. we have been seeing a substantial amount of cases in the past a week or so, and that is actually due to increased testing. So those numbers are going to reflect because we're obviously testing more. But one of the things that I think Alberta can still remain very proud of is that we are leading the way in the amount of tests that we are performing. So as of yesterday, we had performed just over 105,000 tests here in Alberta. The only place that is outdoing Alberta is Australia. So maybe we'll be able to give them a little bit of a run for their money here quickly. So that is something that's very positive coming out of Alberta. If we're looking at kind of that Calgary zone, which is where I am located, and I'm sure a lot of you are located, Calgary has had just over 2,000 cases. So like I said, there is that 71% within the Calgary zone that we are seeing here. And some updates that have recently come out about with COVID-19. So symptoms may take up to 14 days to appear after exposure to COVID-19. And this is the longest known incubation period of this disease. So before we were kind of saying that 2 to 14 days, now we're just saying it could take up to 14 days, but recent evidence has indicated that the virus can be transmitted to others from someone who is infected but not showing symptoms. So a couple of days ago, we were really just saying people were either symptomatic or asymptomatic, and asymptomatic was really that spreading of the infection before they showed symptoms. But now we're actually seeing that some people are just asymptomatic and they never develop symptoms. And then, so we've broken this into two categories now. So have not yet developed symptoms as pre-symptomatic, and then never developed symptoms as asymptomatic. So really we've just changed that wording surrounding asymptomatic transmission. So we are seeing people who just never develop symptoms, but are a carrier of the virus and are spreading it asymptomatically. So that is something to just be aware of within the updates. Another thing to be aware of with updates is we are seeing some new symptoms. So some agencies are reporting diarrhea and others are runny nose in combination with that sore throat, shortness of breath, fever, cough, change in smell or taste suddenly. So there are some new and developing symptoms. So these are the two that we've identified in the kind of the past week. So that diarrhea and runny nose as symptoms. So those are the only updates since last Friday. So there's not a ton of them, but I just wanted to keep you guys as up to date as possible with the new and developing information that we're seeing with COVID-19. So moving on. So talking about PPE. So where you work in your organization can depend on what you need to wear for PPE. So there's a few different components that I'm going to talk about here. So the first one I'm going to talk about is administrative tasks. So this could be admin, this could be leadership, anyone in a management role who does not involve direct contact with clients. So if you can have that 2-meter barrier between yourself and an individual, no PPE is required. This could also be if you are in an admin station and there's a wall or a glass barrier between the two of you, then no PPE is required. So what you're going to do is you're still going to use social distancing. So you're going to use that 2-meter space between you and other folks. You're going to wash hands before you get into that administrative area so that area is continuously kept clean. You're also going to wash your hands before and after meal breaks. So anytime you are leaving that administrative area and then coming back into it, you want to make sure you are performing hand hygiene appropriately. So we will talk about that a little bit later on in the presentation. This is just really a breakdown for what PPE is needed based on where you work in your organization and what type of contact you're having with clients. So the second area is you're providing direct contact to clients. So you can't necessarily keep that 2 meters of distance. So this could be anyone in a healthcare setting. So a nurse or a paramedic, could also be outreach workers, peer support workers, anyone working with direct contact in a shelter setting or a drop-in setting. So if you are at work and you are in direct client care, this applies to you. So you should be in a procedure mask or a surgical mask. So just a mask that is covering your nose and mouth mucous membranes, gloves, and then eye protection. So again, we will go through how to put this on, when to change it, all this stuff a little bit later in the presentation. But you're going to change the mask if it's wet, damaged, or soiled. So we'll talk about what that means. Gloves should be changed between client interactions, and then you're always going to be washing your hands. So those are the precautionary steps that you can take when you're providing direct client care. And then the last one I want to talk about is janitorial services. So some organizations kind of share those janitorial duties between their staff. So nurses and paramedics and outreach workers and peer support workers all take a part in cleaning space. Other organizations have a specific janitorial service that comes in on top of that. So PPE for that should be the procedure mask as well, gloves, and then eye protection. And then the same precautions and measures should be taken with janitorial services as to if you're having direct client care. So the reason janitorial services need that mask and gloves and eye protection is because when you are cleaning, whether you're using like a spray or disinfectant wipes, you could be bringing that virus back up into your face. So it's really important to protect yourself from that potential exposure. Also, if you are spraying and using like a spray bottle, you want to make sure you're spraying it into a cloth as opposed to just like spraying it willy-nilly, just because that is an aerosolizing procedure. So it can cause those particles to lift and then people are more exposed to it. Okay, so if we're talking about putting on PPE, the first thing you want to do is you want to wash your hands. So this is before you put on anything. Always wash your hands. You don't want to be applying PPE with dirty hands because then you're just contaminating yourself essentially. So when you're washing your hands, you want to make sure to wash them for at least 20 seconds using soap and water. If you don't have soap and water, you can use alcohol-based hand sanitizer. One thing I do want people to know with alcohol-based hand sanitizer is your hands have to be clean. So if they are visibly soiled or visibly dirty, you need to use soap and water. So alcohol-based hand sanitizer will not remove viruses and bacteria when they're in the presence of like dirt, just because it just doesn't work well. So you want to make sure if your hands are visibly soiled or dirty that you're using soap and water just so you can actually physically scrub off all those particles. So you've washed your hands, now you're going to apply your medical mask. So medical mask or procedure mask should be applied at the start of shift and only changed when soiled or damp. So soiled it essentially just means dirty. So that could be physically, like you can actually see dirt on it, or if there's vomit or blood or anything like that on your mask, that would be considered soiled. But it's also if someone's like potentially coughed or sneezed in your face, it is considered dirty even though you can't see those particles. Sometimes the straps break off of the mask, so make sure you just get a new mask with that as well. So don't kind of DIY your mask if it's damaged, then throw it out. Dampness. So the reason why we say damp is once these masks get wet, they're no longer very effective at preventing the spread of infection. So different agencies have identified different amounts of time, just based on where you live and what agency you work at. If you're looking in BC, it's about 4 hours. Alberta Health Services is 2 hours that you should be changing them. If we're looking in community settings, community agencies in BC and other provinces are just saying, change it when it's soiled or damp or damaged, just because the supplies aren't necessarily as readily available in the community as they would be in a hospital setting. So just changing your mask when it's wet, soiled, or damaged, and that potentially could be the entire shift if you're working 8 hours. Eye protection. So eye protection is always going to go on after you apply your medical mask, and you want them to be clean going on. So we'll talk about how to clean them and all that. And I'm going to show some videos a little bit later that I'm going to narrate because the volume, I guess, is not showing up for the webinar for participants. And then after you've applied your goggles, you're going to put on gloves. So gloves are changed after every interaction with a client. So hands-on care, if you're laundering clients' belongings, if you're cleaning, you want to make sure you're changing those gloves before you interact with another client. One of the other things that I want to talk about with donning PPE, even though it's not technically like classified as PPE, is your footwear. So because COVID-19 is a droplet precaution, the droplets actually that you produce with like you sneezing or coughing or moistly talking, they're actually very heavy. So they do drop to the floor. That's why we're not really worried about aerosolized, we're not essentially worried about airborne transmission unless we're using aerosolizing procedures because those particles are so heavy. But if those particles are heavy, where are they landing? They are landing on the floor. So our floors, they're disgusting right now. So pick one pair of shoes that you are wearing to work. Those are now your work shoes. You're not wearing them out to the grocery store. Don't wear them home. Those are your work shoes. You wear them only at work. When COVID-19 is done, we burn them. We get rid of them in some aspects so that we can reduce the risk of transmission through our footwear, just so we're not bringing that potential infection, say, into the grocery store, bringing it home to your families. So that's another thing that we can, kind of an add-on protective measure that we can take just to keep everybody safe. So this next video is just going to show how to put on a mask. So I am going to kind of narrate it through, just because I was told the sound isn't really working. So we'll go through it together, and then if you have any questions at the end, we can answer them then. Okay, so if you're fitting the mask, you want to take the soft metal strip and put it over your nose like so. And then you're going to take one strap, put it behind your ear, and then take the other strap, put it behind the ear, and then pull the bottom down below your chin. Then you want to just tightly make sure there's a tight seal at the top, and then down below. So this prevents the spread of infection from you. So surgical masks or procedure masks, they are preventing the person who is wearing it from transmitting any infection. So whether or not they're symptomatic and have a cough or fever or muscle aches, anything like that, or if they are asymptomatic and could potentially be spreading that infection, the mask is to essentially protect the person, other people from the person who is wearing it. Now, granted, because masks do cover your nose and mouth, the individual who is wearing it is going to get a little bit of protection just because those mucous membranes are covered. But the mask is mostly to protect everybody else around them. So that is how to put on a mask properly. And then after the mask is on, sorry, I'm going to put this back on just to show. So mask goes on again, kind of tight seal around the nose, one ear, second ear, then below the chin. Make sure it's a good seal. Then you can apply your goggles. So your goggles could be anything. These are just safety glasses. They go on top of your mask, looking like so. And then your last step is just your gloves. Okay, so it always goes mask, goggles, gloves. I'll quickly take this stuff off, and then we'll talk about taking off PPE, so you can hear me better. So the first thing you want to do when you're taking off PPE is actually to remove your gloves. So the first thing that comes off is your gloves, and then after those gloves are off, you're going to make sure you wash your hands. So either washing it with alcohol-based hand sanitizer or doing a 20-second scrub with soap and water. After you've done that, you're going to remove your eyeglasses first. So my eyeglasses are on. You're going to want to take them from the sides. So you never want to take any facial protections, whether that's your mask or your eye protection, from the front, just because that's the dirtiest part. So you don't actually want to touch it. So you want to take it from the side and then just place it down. And then same with your mask. You're going to take it from the side with your ear loops, pull out in front, and then dispose. So I'm actually going to, same thing as we did with putting on the mask, I will guide you through it when we go through the videos as well, and kind of do a demonstration while they're showing it, just so that you can get kind of the verbal and the visual component to how to put it on and take it off. So the next video is going to talk about taking off gloves. I'm just going to put on some gloves here, and then we'll walk through so you can get a visual from me and a verbal from me, and then a visual from the computer as well. So one thing, all these videos have been adapted from the Alberta Health Services donning and doffing videos. So I've just taken pieces, like clips from them to show you, but I can send out the link to the full video as well at the end. Okay, so taking off gloves. So it's the first step to taking off any kind of PPE. So you want to take from the inside and you're going to pull it off. So you don't actually want to reach underneath the glove just because it's going to be dirty with your clean. You're going to be putting dirt under with your dirty hand. Okay. Then with your clean hands, you're going to go under the glove because they're both clean, and then pull out. So they're going to be inside out when you take them off. Sometimes it takes a little bit of practice, and then you can just throw it away. So also, once you've removed your gloves, you always need to clean your hands after, just because you are putting technically like dirty material onto clean material. So want to make sure give them a scrub or use alcohol-based hand sanitizer after you've removed your gloves. Okay, the next one we're going to go into is mask and eye protection removal. So bear with me here. I'm going to put back on my PPE, and then we will walk through this together. Okay, so like I mentioned before with PPE, you always want to take it either from the back or the side. So you're going to take it by the sides, remove it like so, and then you're just going to remove it in kind of one swift motion. So that is either the goggles or the gloves. I'm not sure if anyone's using face shields. If you are, let me know, but it's the same thing. So the face shield's going to cover the majority of kind of your face and then below your neck, but same thing. You want to kind of take it from the back. You still don't want to touch that front of the face shield and move it forward. So some people like to lean forward, which I'll show you when I take off the mask. You get a little bit of momentum that way, and it can help just kind of prevent those particles from coming back up if you're kind of leaned forward. Okay, so mask removal. So one of the things I like to do with the mask removal, there's a few different ways you can do it, but what I like to do, especially with these loops behind the ears, is I like to pull one out and then kind of pull the other one out, just because then that momentum's gone. Then I like to lean forward, pull it off, and then you just dispose of it. So it's pretty easy that way, especially if you've got that momentum, negative momentum going downward, then it just kind of falls off and can go into the garbage. And then always use hand sanitizer once you've taken off your mask and goggles, or just give your hands a scrub for 20 seconds with soap and water. So donning and doffing with personal protective equipment, there are some additional resources as well that we can use. So whether that's, sorry, it says overdose response, but it's just in general for general PPE. So Alberta Health Services has created some online modules with their infection prevention control. So it's PPE and use. So they take about 30 minutes. These webinars, or sorry, these modules are designed for non-AHS staff, so anyone can access them, especially if you're finding staff are not super comfortable with putting on and taking off PPE. It could be a really good, just an added learning activity for people. Also, there's that donning and doffing PPE video that I've been showing little clips of throughout the presentation and kind of narrating myself. But that video, it's about 15 minutes long, and it goes through kind of the process start to finish. So depending on what protection equipment you are using, whether that's like an N95 or a surgical mask, it goes through all of that. If you're using goggles as opposed to just regular like safety goggle like eyewear, or if you're using a shield. So it does go through different scenarios of what people could be wearing. And it's a really great video in that sense. But I can send out those as well, or you can just take a snap of this screen. This is exactly what they're called online on the Alberta Health Services website. So personal protective equipment, so cleaning, changing, and disposing of PPE. So there is a clothing kind of marker on there. So some people will be wearing gowns. If you're not using aerosolizing procedures, so that would be like using oxygen, using a face mask, doing CPR, it's not necessarily indicated, but we will talk about that when we do overdose response next week. But it isn't a bad idea to have an extra set of clothing at work. So, or just like an extra sweater, anything like that. So you should change your clothing if it becomes soiled, wet, or damaged. So if someone's been coughing on you, or like kind of before you can get a mask on them, that type of thing, it is nice to have just an extra set of clothing so you're not kind of spreading that transmission throughout your site. When you get home though, which we'll talk about this on Friday, because we're going to talk about kind of community safety with COVID-19 and what you should do to keep yourself and your family and your community safe when you're working in the front lines. But when you do get home, you want to put everything you were wearing in the laundry. So directly into the laundry. If you don't have access to like on-site laundry at your home, just put it in like a garbage bag. You can even put it in a garbage bag at work, and then just put it all in at once when you can do laundry. Face masks. So we are going to change them when your mask is visibly soiled. So like I mentioned before, so if there's blood or vomit or dirt that you can see on the mask, you're going to want to change it. But also if someone's been, say, coughing in your, like directly in your vicinity, there would be particles on it. It's a good idea to change it. You're also going to change your mask when you're leaving work. So if you're going on a break and then coming back, anytime you take off any type of PPE, whether it's your mask or gloves, that PPE is done. And goggles, if you take them off, they need to be cleaned, which I'll walk you through how to clean them as well. So once it's gone off your body, it stays off your body and you're putting back on clean PPE. So if you're going for lunch and you're taking off your mask, you're not putting that same mask on when you come back from lunch. So with goggles, you can use them throughout your shift. Most goggles are reusable, and they just need to be cleaned. So generally people clean them at the end of shift when they're leaving work, kind of, or as needed. So if they've been soiled, give them a clean. I personally like to clean mine just every 3 or 4 hours if I'm in direct contact with clients. So within that kind of 2-meter barrier. So how you're going to clean them, you always want to start from the dirtiest part of your equipment to the cleanest. So you're going to clean the insides, then go out to kind of the handles, and then do the outside, because the outside is going to be the dirtiest. So you can clean it with soap and water. You can clean them with Cavi wipes or Excel wipes or any kind of bleach solution that your organization is using. One of the things that I do recommend with safety goggles though is after you've done cleaning them, run them under warm water for a little bit, and then either pat them dry with paper towel or just let them air dry. By running them under water after, it kind of gets rid of those streaks so you can actually see clearly, and gets rid of any extra residue that might have been left behind by your cleaning supplies. So I like to clean them every couple hours when I'm dealing with clients, but I always clean them after I've been in contact with a symptomatic client, or if I've responded to an overdose, then I always give these guys a good clean after. Gloves. So gloves you're going to change after any kind of client interaction. So we're not going to go from one client to another with the same pair of gloves, because then we're just moving that potential infection around. So anytime you've had direct care with a client, you're going to want to change them. Anytime you've had direct care with symptomatic individuals, you want to change them. But these guys, they are one use only. So don't clean them. Don't use an Excel wipe on them. Just check them out once you're done. Okay. So personal protective equipment for clients. So some of this information is a little bit new. So we're talking about mask use with clients. So when clients come in at most agencies, they're doing a screening when they first get there. So does this individual have a fever? Do they have a sore throat? Do they have a cough? Are they having difficulty breathing? Do they have muscle aches? Has their smell or taste changed drastically recently? Do they have diarrhea? Do they have a runny nose? So any of those kind of 8 symptoms, if they answer yes to them, we're getting them to wash their hands. We're going to get them, most clients who come into any organization, they should be giving their hands a wash anyways. It's just good practice, but they're definitely going to give their hands a good scrub. 20 seconds or with alcohol-based hand sanitizer. We're going to put a mask on them. So again, that mask is protecting everybody else from what that individual could potentially be carrying. That mask is preventing their droplets from getting all over everybody else, but also getting on surfaces that we potentially need to clean. after, you're going to report it to someone. So we want to be consistent in making sure that individual is masked for the next 10 to 14 days, depending on their symptoms and whether or not they've been in contact with a COVID-19 positive individual. So that's all part of your screening, that general screening process when people are coming into your organization. But another thing that is fairly new is if staff are performing care within 2 meters of a client, it is a good idea to get the client to put on a mask as well. So staff will already be in a mask because that's just part of practice right now. When you get to work, you put on a mask, you put on your goggles, you put on your gloves. But if you are in that close proximity, so whether you're doing wound care, if you're drawing blood, if you're doing laundry with a client and they're very close to you, if you're doing any psychosocial interventions and they're very close to you, it is not a bad idea to put a mask on the client just to protect yourself and to protect staff. This, however, will depend on your organizational supplies. So whether or not your organization has the supplies that will last to allow you to do that. Obviously, that social distancing plays such a huge part in the transmission of COVID-19 that if you can keep that 2 meters distance between yourself and a client, then do that, right? Obviously, that social distancing, that hand washing, those are your first 2 lines of defense. This added PPE is just an added benefit to that, but it's not a replacement. So we still need to keep focusing on keeping that 2 meters distance and also washing our hands. And also it's, if we're starting to put lots of masks on clients, it is about having those conversations with them as well, that we are putting a mask on you for your safety, for the staff safety, and for the organization's safety. We value you, we care about you, we want to keep being able to offer you supports. And we can't do that if everybody is sick. So, and we want to make sure that we first and foremost are keeping our clients and our staff safe. So that is why we're asking to do that. But from what I've kind of found working front lines is a lot of clients are very willing to put on a mask. This is a very scary time for them as well. This isn't a infection that is being selective on who it's targeting. It's non-discriminatory. So it's affecting everybody, and it's affecting everybody in somewhat similar ways. So it's about normalizing this, right? And having that sense of community with our clients, that we are all in this together. We have the same fears. And you can build on that, like build that relationship, because there is that commonality. And that's something that this sense of community that we're getting because of this infection is actually quite remarkable, right? Like that we're all kind of pulling for each other, and we're all in this together. Okay, I am going to briefly just talk about, putting on PPE, so personal protective equipment for providing overdose response. I'm just going to go into it very, very briefly, just because we are going to be going into this in-depthly next Tuesday when we talk about coronavirus and overdose response, and just kind of drug trends that are going on next week. First thing you want to do though, always wash your hands when you're putting on PPE. So the only difference between this right now when you're responding to an overdose response is it is recommended that you put on a gown. So if your organization doesn't have gowns, that's okay. This is where that extra piece of clothing might come in contact or might be helpful if you're bringing it to work. You can just slip on a sweater. So what we're looking to have covered is kind of this forearm aspect. So you're not, your skin isn't coming in contact with a potential virus. Then you're going to put on your mask, your goggles, and your gloves. So same order as before. The only thing that might be different is your mask might be different. So the surgical procedure mask that you were wearing just kind of in your day-to-day outings at work might be different based on whether or not that organization is providing oxygen, if they're doing CPR, if they've had to call EMS and they're providing oxygen. So anytime there's what we call an aerosolizing procedure, so giving oxygen, giving breaths with a face mask. So that face mask is the one that kind of seals on the face, not just that plastic sheet that goes over the face. Those are all aerosolizing procedures. And if you're doing an aerosolizing procedure, then you're going to need an N95 mask, which we will go over, I promise, in detail next Tuesday. But those masks do need to be properly fitted, or they just don't have that same benefit. So goggles and gloves. And then taking off PPE for an overdose, again, very similar. So your gloves are going to come first, then your gown. So if you're not using a gown, if you're just using a sweater, take off that sweater as well. So different organizations have different policies on when you should wash your hands for taking off PPE. So some people do recommend washing your hands between stages 1 and 2, so that gloves and gown. Others just recommend washing your hands between 2 and 3. So that really just depends on your company's policy. But first gloves, then gown, then make sure before you're going anywhere near your face, you're giving those hands a good scrub with either alcohol-based hand sanitizer or soap and water, then your mask, and then your goggles, and then always washing your hands after. So I know lots of people right now are probably looking at the amount of times you need to wash your hands kind of this past 6 weeks, and I'm sure people's hands are really raw. Cream is going to be your best friend. Moisturizer is going to be your best friend. One of the little tricks of the trade that I really like to do is I will put cream on, and then I'll put on my gloves and leave it on for half an hour and just kind of let that soak in. And I find it does help. It does help a lot. One of the other things that I've heard kind of some complaints about with individuals is that the back of their ears are getting really sore from having to wear a mask. So some places, people who are very crafty, I am not, have been making these little bands. So these little bands just go behind your head. So I'll quickly show you here. Let's put my hair up just so that you can kind of get a good idea of what this is. So I'm putting on my mask. So this little band's just going to go behind your head, and it's going to attach to the back there, so that it can either go over your ear or under your ear. So this takes the pressure off of your ears. So from what I've heard, they're very easy to make. Like I said, I'm not crafty, but a lot of people who are very crafty have been making them for different organizations. So they're out and about. It's really just a sheet of fabric with 2 buttons on either side. And it really does help kind of save the back of your ears if you're looking for a little trick to kind of save your ears. Other people are just making headbands with some buttons on it to kind of help reduce that rubbing of the handles on your ears. So that is actually it for kind of presentation wise. I did want to just go over, Westside Harm Reduction does make infographics for COVID-19. These are just some of them. So safe outreach during the coronavirus outbreak. So that goes through personal safety tips, how to keep your community safe, screening and communication. And then the second one that we have is coronavirus FAQ. So just our fact sheet for shelter and drop-in settings. So it just goes questions, answers, kind of how to go about things in a shelter setting. If anyone's interested in that, please feel free, shoot me an email. I'm happy to send them your way. So we're going to get into our question and answer segment here. One thing I did want to mention though is if you do have any questions that kind of pop up midweek or in between our webinars, feel free, send me an email. It's info@westsideharmreduction.com. We're happy to answer any questions you might have. And also if you're finding there's just something that you want to bounce ideas off of with your organization, send me an email. I'm happy to have a conversation with you over the phone if that's easier for you. We're all in this together here. We're all trying to adapt to new work environments and be as flexible as we can. So Westside Harm Reduction is no different here. We're happy to be flexible and help everyone in this time. So feel free, don't hesitate, please reach out. But that is the end of our session today. Thank you so much for joining us. We will be having another presentation on Friday, still at the same time, so 10 a.m. It will be going through community safety. So that's how can I keep myself safe? How can I keep my family safe, my colleagues, my community when I'm working frontline in a pandemic? So that will go through everything from laundry to how often I should be cleaning surfaces and that kind of thing. So look forward to seeing you all there. Have a great day.